Are you feeling unsure about the SCA exam? Maybe you've tried everything and still you haven't passed your exam. You're asking yourself, what do I do next? Today I'm going to share with you the story of a GP trainee who went from 72.5 to 81.
If I could pick up my confidence after having failed 4 times.
She's going to share with you what exactly she did differently. Congratulations on passing your SCA exam. Tell us a little bit about yourself.
I'm Dr. Chisom Eliakim, GP trainee in West Midlands, and I started my training 2020, August. So that has been a very long time. And I didn't have much problems with my AKT, but when I got to SCA, I mean, this is the 5th time I'm doing this exam, and that's exceptional attempt. I was allowed to do the exam. It's the 2nd time I'm doing the SCA exam. I had done SCA exam 3 times now. 3 times, and before it was now changed to SCA. So that's me, a lot of struggle, and I'm here today.
What was your journey when you were preparing for the SCA first time round? What were you doing at the time?
You know, I had done 3 SCA. So I had to first of all understand the SCA exam, the nature, and how to go about it. I was used to recorded consultations for the SCA, and I noticed that the same problems I had with SCA, I was beginning to experience them also in SCA. Though I found SCA to be a better exam because I didn't need to look for the patients. But there were lots of things I didn't really understand about the SCA. Though I had attended courses that gave me good coverage, good knowledge base, but then I couldn't really understand how to put things together. I practiced with friends, and one day a friend told me, you need a coach. I think you need a coach, because the way you are going, she was worried about me. I was just staggering my consultation from here to there. Though I knew about eyes, and I felt I understand eyes, I was not really doing eyes. You know, I didn't really understand when it should come in and how to manage it. So I was just flowing like that. I thought all they wanted was the knowledge. But when it occurred to me that they needed more than knowledge, they needed this consultation to be structured in a particular manner, I started struggling with that structure. Maybe towards the end, I may say a little bit more about what helped, make the changes that I have today. So I struggled a lot with the structure, with timing, and I became very anxious about the whole thing. Any little thing, I get overwhelmed. So that was how difficult it was for me preparing for the SCA exam. Until a friend that had passed through your course told me, I know someone, I failed, and I went for his course, and I passed, that I should try it out. And that was how I came to you. And I'm happy I did, I must say that.
Thank you. So I remember when we had our first chat, you had some stress because of placement issue as well, and there are other things going on. Share with us what was going on in your mind then.
So when I had my maximum 4 placements, 4 exam attempts, I was told in my last ARCP that they were going to apply to the exam board to see if they would give me exceptional attempt and then get me a placement. Within 2 weeks, the exam board approved for me to have an exceptional 5th attempt. but I didn't get placement from August to January. That whole 5 months, it was endless. So I was not sure what I was looking at. I was not working, I was not earning money. I couldn't even go doing locum because I was not sure when I would be given placement. I was not seeing patients. I was not consulting. Even when you are doing role play with your friends, it's not the same because it's a hopeless situation. I didn't know where to go from there. And it was at that point we read RCGP guideline, myself and a colleague in similar situation, and they said we could write an exam, at least one attempt outside training. And it has to be 6 months outside training. What that meant was I needed to do exam in February. So we chased the college, chased my deanery until they got me a posting in January. And I got back into training by January. So at that time, I was confused, I was defeated, I felt abandoned. I mean, my mental health was not in the best place. I lost all hope, all confidence. If I was in training where I was receiving feedback from my trainers and I couldn't pass the exam, how possible is it for me to pass this exam outside training? So that confusion didn't help matters.
So that was quite difficult. And what did you do then to build your confidence and get ready for the exam?
I enrolled in the course. I struggled to enroll in the course because I was not working. I didn't have money. But you gave me the freedom of paying instrumentally in 3 installments. So I was able to pay the first installment and we started. Now, the way you started, you stressed a lot about eyes. And for the first time, it occurred to me that if I don't get eyes early enough in a consultation, my consultation will not have a bearing. I may not know where I am driving into. You introduce the 3 buckets: eyes, biomedical, psychosocial. And each time, that first time I want to consult, I will just draw 3 buckets: eyes, biomedical, and psychosocial, and put it there. And I make sure I'm getting my eyes at the beginning because this was the mistake I was making. Now, when I did the SCA the first time, I was not asking eyes. Now, when I get to management, the patient will take me back. I'm trying to manage the case as a not be from the knowledge of what I know of that case, but the patient is thinking of another thing. And when the patient brings in that question, it just occurs to me, this is this patient's expectation. This patient is not looking for what I will do or that. This is what he or she wants. And if I don't address that, I'm going to be failing both psychosocial and management. And that was something I picked. Immediately I picked that eyes, I imbibed it and incorporated it in all my consultations. So it really helped a lot. The biomedicals, I didn't fail any data gathering at all. None. And I didn't spend so much time. The first day exam, I will be going to management by 8 minutes, some spilling over a little. And what time do you have for management if you do that? And then if I get to management by 8 minutes and patient throws me off with a question based on what his expectation from that consultation is, I mean, I get lost, I get anxious, I lose it, I'm a bit shaky. Now, I failed that exam by 2.5 marks. If I knew what to do on time, if I had proper coaching and direction like you gave me, the chances are that I wouldn't have failed that exam because I was really so confused. I now have my challenges, I have my problems, which I think I may talk at some point, but knowing eyes early was a game changer for me, really.
Are you feeling anxious about the SCA preparation? Maybe you're not getting constructive feedback, you don't know whether you're doing the right thing. If you're looking for one-to-one support, I'd love to help you. Click the link down in the description below to book a call with me to see how I can help you to pass your exam. What were you doing in terms of priming a case before you started, Chisom?
Depending on the case, there are some cases that they give you, I mean, it's just vague. There's nothing you can't do anything about it. But then there are some other cases, when we did coaching, and I picked that from you. You will ask me, look at the history. What are you thinking? What is it you are expecting from, at least from the history you can get? Before, I would just look at it and keep an open mind and go for the case. But when I now look at the history, at least the ones that try to give me some history, and I ask myself, where is this case likely going to? Where will I be focusing on? They're giving me a background of somebody, a veteran, retired veteran. What will I be thinking of? What could come out of this? I'm thinking of, could this be mental health? Could this be post-traumatic? So it gives me, I prime it. And then you see an age, 6-year-old, 7-year-old. What could be the possibility here? Could it be behavioral? Could it be a neurosis? Could it be, you think of, I see a 79-year-old and I see in history frequent falls as background. And I'm asking myself, what will they likely bring here? Is this patient confused? Is this patient taking some medications? And I look at the medications, can these medications be contributing to this patient's problems? Now, my job is half done for such cases. But the ones that are blank, you just keep your mind open. And that was really very helpful, I must say.
So you went in anticipating and had a game plan based on the existing information. At the same time, not prejudging a case, but anticipating, open mind, and going in more prepared. So tell us, when you went to ask some of the questions, sometimes trainees struggle because it may sound a bit formulaic. How did you phrase your questions?
I don't know whether I told you this, that I have neurodiversity problem. I have a bit of autistic trait and I'm dyslexic. But of course, the college is not going to give you extra consulting time. The best they will give is extra reading time, which does not make any sense. Because the information they give is so little for you to give me extra 45 seconds to read. It didn't make sense. So on that background, it's difficult for you to follow the normal routine structure that other people follow. So I had to get the things I need in a consultation and followed the patient. I know that in my 3 buckets, I need to get these eyes. And I know I need to get the biomedical. And I know I need to get the psychosocial. So I didn't put like a formula is going to be this way. I just followed the patient as the patient presented. And that helped me not to miss the cues. Because when they say a thing and I say, why is that? Why do you think that is happening? So for me, that find it difficult to follow a particular formula, it has to be this way, because if I don't ask it at that point, I will not remember. So I had to devise, that means, which is something I learned from a coaching. When PSW did screening for me, they recommended coaching for me, 4 sessions of coaching for me. And I picked something there also. So I also added it to my consultation. So I knew the important things to do, and I asked my questions based on what my patient told me. Unlike a medical student kind of data gathering, which I was doing before, just I was now focusing on what I have there, what is important, trying to exclude the red flags as much as possible. In fact, most times I pick my red flag from the concerns. A patient tells me, oh, I'm just worried about cancer. And I ask those red flags at that point. Any loss of weight, loss of appetite, smoking. So I didn't quite say psychosocial has to be at this point. Biomedical has to be at this point. For me, it was a complete thing. We were just talking, and we were just chatting. I mean, my psychosocial also, they were good, but my peculiar situation, and when I say peculiar situation, which is still timing, because I talk at times, putting a neurodivergent in a jacket of 12 minutes is the worst thing you can ever do, because your brain functions a little bit differently. That timing even gives you anxiety. And to think that the timing is before you, you are looking at that time and your anxiety is going up. Oh, this. So you get to management and you discover that some of the things you even know you are aware of it, you are not articulating them. It's your anxiety that is playing up at that time. But because you have knocked that structure in me, because I had 5 sessions with you, and then you gave me 1 extra session just before exam. And in every session, you make corrections, you tell me how to go about this. It wasn't even more of knowledge, but you were putting things together for me. Say, don't say this way. You will stop me. Don't say it this way. Say it in this way. Like I struggled with managing resource stations, and I would like to go back. I don't remember the word you told me. You told me the ship has left the harbor. That word, I never forgot it. So because the ship has left the harbor, I don't need to go back to the harbor to start digging things from the harbor. Where is this ship? We have done something. Where are we going from here? And you take it from there, because you go back to the harbor, even in 15 minutes, you are not going to finish. So these were important things I really picked. So I wouldn't say I followed a rigid style of how may I help, this and that, what were you hoping today, what is your idea about this, how is this? I mean, it came like a conversation, and that is something, when I understood what to do, I had to figure out with my kind of challenge how to drive my consultation. And that was really quite helpful.
Have you found the insights in this video useful so far? If so, you might be interested in SCA Blueprint. Just click the link down the description below and sign up, and you will get a teaching from me every day for the next 7 days. It's very important for the audience who is listening and watching to understand that you don't have to consult a specific way, and there's no one right way. What you have to do is develop your own style that feels natural to yourself. And in the beginning, you have a structure that helps you to know how you proceed, but then you don't need to be rigid with it. So, what's really important is to be asking these questions in context and have a conversation that flows naturally and uncovering these red flags and eyes as you go along. And that's really where you have good rapport with your patient. Whereas if you just go through a list of questions and ask it as in a checklist, it doesn't work that well. So thank you for sharing that. And also when it comes to the discussion of results, it's a very different way of consulting because you have to be using the existing information. A common pitfall is going back, as you mentioned, and this is where you waste a lot of time. So you want to proceed and go to the next point where, for example, the patient is waiting for the results. They don't want to go back. They want to know what's going to happen next. And also, you mentioned about asking the patient and picking up these cues. So it sounds like you were very curious and you were more interested in what's important to your patient the second time. So tell me, how did you change that mindset and the attitude?
I had to change that because each time I have a session with you, you will stop me. You will say, this patient said this, or you allow me to get a particular point, and then you will stop me and say, did you find out why this patient said this? Like you will say, this patient said, my wife asked me to come. What was the wife worried about? Did you find out the wife's eyes? And in my head, I'm like, I'm going to have another session with you in a few weeks' time. I need to practice this and get it into my system so that by the time I see you, I won't make the same mistake. So you see, those cues, before you know it, it became a second nature. Someone just says it, you pick it there. Because of my peculiarities, I wouldn't want to leave it till sometime later because I will not remember to ask it. So I tidy it up there and then continue. And that also helped me not to dance forth and back because I had this problem of repeating myself over and over, the same question repeated like 3-4 times. Because of the way I'm asking, I'm just asking questions and patient stops me and says something. I've forgotten what I asked the patient because I was following a rigid structure. And when I come back, I'm not sure what I have done. And I go back asking again, yeah, do you smoke? Have you lost weight? Have you? Yeah, doctor, you asked me before. I'm like, oh, I'm sorry. I'm sorry. So you avoid those things. This exam needs a lot of curiosity. And anybody in your course will understand that because you make people understand that. You need to be curious. Find out why this is happening, why they are worried. Be interested. Try to know what is happening behind the scene. How is this affecting them at home? How is it affecting you at work? Try to be friendly. In fact, in the exam, I chatted with one of the patients I was talking with. We chatted about her job, and I said, oh, I just feel like coming to your area with what you have to. He said, oh, it's a lovely area, come. You know, that kind of situation. We just thought, and that builds your interpersonal skill. Oh, you know, she thought, oh, because of my job, you know, I don't want this to happen. I won't mention details of things from that exam, but these are things we can actually build on. Curiosity. I had a patient that was turning me left and right, didn't want to hit at the point what it was, but I kept going back. I'll ask her something, she will tell me something else, and I'm like, I'm getting to end of data gathering. I don't know, I have no idea what I'm going to manage. And remember when we had coaching session, I had cases like that, and you will stop me and say, where are you driving to? Where are you going to? What are you going to manage? And I tell you, I don't really know. So curiosity will help you to know when a patient has been told to act in a particular way. And you try to ask some questions, and when the patient opens up, the person will tell you everything without holding back. So they do that to see how curious you are. Ask about job. Oh, why? What's this? Some medications, they will deliberately not write it there. And why asking, apart from these medications here, is there any medication that you take that I have not seen in your record? Oh, doctor, I'm taking adapalene. You're taking adapalene. Okay, that's fine. Now, this patient is taking adapalene, and for some reason, the patient shouldn't be taking adapalene for what the patient is presenting with. But if you didn't ask such things, didn't try to be that curious, you may not get there, and you may be managing something else. And when you come out, you think the college has done the wrong thing by not giving you the mark you were expecting.
A change in approach makes a big difference in the way that you approach the management then, because then you would know what you're managing and thinking about the end in mind. So tell us a little bit about what are the main changes you made in the management.
First is to start with eyes. Thank you, Mr. John, for coming today and for explaining everything to me. I know you came in expecting that, or you came in having an impression that you may be having a cancer. But from what you have told me, this mention. So start from the eyes, because that's what will give you patient satisfaction. Give the patient reasons why it is not that. And if it is that, you say, yes, I think I agree with you because of this. And you were expecting that I should give you this. So once you address the eyes, then you will be able, after the eyes, you can now go on with other things, how you manage. I think it's important that you address that and tell the patient what you think it is, and several options how you can manage them, this, and try to find out from the patient what appeals to him, because I had to struggle with that a lot. I was so doctor-centered before, but I really had to struggle a lot. I said, okay, eyes, handle eyes, explain what the options could be. Just give him an opening at that point to talk. What appeals to you? And when he talks, you people can now talk. And then, but for me, because of I still have time problem. And of course, I know I always have that problem. But following this structure, doing the important things early in time, I know I will never finish the management. Before time even runs out, while talking, I will do safety netting so that I don't get to miss it. I have to get it in there ahead of time. There's no place where it was written that safety netting has to be the last thing. So you may be talking and you say, Betty, if you see this, come back to us or call an ambulance, and then you continue what you're talking. So you don't miss out. If you are my kind of person anyway.
If you think about it, if the patient is coming to you, they want stronger pain relief, but you haven't readdressed that, then you're talking about other things, then in their mind, they're still thinking, is this doctor going to give me something stronger, or am I going to be fobbed off? So then if you readdress that, then they know what you're thinking, what the this is suitable, or if it's not, what else you're going to provide them. And then they can move forward with you. Otherwise, they might be here and you're here. So that's really good to see that you implemented that. Share with us in terms of on the day of the exam, how did you manage your nerves?
I don't know, for some reason, I would say I was not anxious. I felt I've got what I needed for the exam. All I needed to do was to calm down, don't think about it, just face the exam. So I went, I prayed, I believed God to help me remember all that I've been doing and not start getting jittery about things. So that's just it. And for some reason, I don't know. If I feel I didn't do well in a case, it doesn't bother me. I just leave it and move on. But before, I will not do a proper housekeeping. I will carry that to the next case. And while handling the next case, I will still be thinking about the previous case. But this time, I don't know, for some reason, I was relaxed. I don't know. I don't know why, but I was.
That fear that you had turned into something that was more positive, and you had faith and you just move on. That was really good to hear from you, because when you're a bit more relaxed, then you can perform well.
Yeah, you need to be more relaxed to perform well. If you are not relaxed, you will not. And I had to compare what I did in the last exam and the extra information I have got this time, to manage my consultation. And that helped me. And I told myself, if I knew this, there was no reason why I should have even had problems with SCA also, because I was doing the doctor thing. I was taking history and I was just going. And it was as though nobody was telling me, nobody was really telling me what to do. They just look at it, okay, this, nobody could understand me. But when I think also understanding or getting the neurodivergent diagnosis was helpful to me, because it now made me know that I need to fight for this. I don't need to relax. If I depend on myself, I'm never going to get this. Get everything you need to get. Practice, practice, practice. It is funny to say this, but my husband became my role player. We were practicing morning, afternoon, night, because people really couldn't understand me. My husband is a priest, so he read theology and English. But he listens to these courses and he told me, this is an art. You need to understand this art. He even had to teach me the way to reassure, the right ways to use, to reassure a patient. And if I'm not reassuring the patient, he will stop me. He said, no, this patient, I'm not reassured. So he was doing role play with me. I was doing it, back to back, so that it could become at least part of me. And when I miss it, when I'm getting 2 minutes, he will stop. You have not asked me my eyes. You don't know what I'm thinking of. I say, oh God, because I had to draw the buckets for him, so he knows what I'm looking at. And he will tell me, but you heard when I said things, he said, I was listening to you when you were having that coaching with that man. This was what he said. You are not getting it. And I'll say, okay, I will come back. He said, this is what he said. So he listens well, and he was able to help me. Though I was practicing with a trainee, but you see, that practice I was doing with my husband was the best practice I ever had. Because this is somebody that knows me, he understands me, he knows how affected I have been. And he has been listening to our chats when we meet and, trying to understand, where is my wife missing this? So when we practice, he behaves like a coach. He will stop me and say, no, this is the way. I heard that man talking. That man is quite good. This is the way you need to do. This is an art. You need to do this art. So that was really quite helpful to me. I must add that. So knowing my diagnosis gave me the fighting. I had to put back my fighting cap. Because at that point, I was deflated. I was gone. The day I spoke with you, I cried all through. I was crying as I was talking with you. I said, I don't just know what to do. I don't know where to go. And you asked me, are you willing to prepare for this exam and pass? Or you want to just put your future in the hands of people? You want to base it on assumptions and that and that. Okay, you don't have money. I can allow you play in installments. Think about it, get back to me. And I thought hard. I got back to the lady that introduced me to you. She told me she doesn't know that she failed. But when she enrolled in the course, that she has passed. So that there were obvious changes. So that's what she can tell me really. So she encourages me to go on.
Well, I have to give you credit because it's based on your individualized effort, and also credit to your husband who helped you along the way, because you were really open minded and you took the feedback, implemented the changes, and that's what's the reason you got there. And I'm pleased to see that you are fully committed, you put in the work, and that's where you do unlock these things and embed the good practice. So I'm really pleased to hear that this process has actually changed you and your confidence has been transformed in a way. And share with us last piece of advice for somebody who maybe they just got the results and they're feeling defeated right now.
I was there several times. So what I will advise such a person is to just calm down. Don't lose hope. The way you feel is natural, but then you need to move forward. You need to ask yourself this question: do I want to be a GP? And if the answer is yes, you ask yourself, is there something I need to do that could help me? Is there something I have not tried? Because a lot of us, we have tried a lot of things. A lot of people have helped us. A lot of people have good knowledge base. But understanding how to drive the consultation is a problem for so many people. You find out you are doctor-centered, you are not doing the right thing. So it's not a time to give up. If I could pick up my confidence after having failed 4 times and being out of training for more than 5 months, not knowing where to go to, and today I was able to pick up that confidence and I went for that exam and passed, then anybody could do it. Even with my neurodivergent issues, anybody could do it. And if you feel you may be struggling with some things, understanding the structure, following it, it may be a good idea to ask your ES to refer you to PSW to see if they can screen you for neurodiversity. And if they screen you, if you have that understanding, you will now know exactly where you are standing and how to fight. And that will be helpful. Hope is not lost. As long as you are still in that training, you can make it. Brace yourself up. This is me the 5th time, the last time, final time. I picked up my confidence. Anybody can make it if I can make it.
So your story is so inspiring, and I know that you're going to CCT in a couple of weeks now. So it's really good. So what are you going to do to celebrate when you CCT?
No, but to be honest, when I saw the results and I saw pass, when you are used to failure, you are not sure. You don't know the difference between pass and fail again. I was looking at my result, pass, PAS. I opened it to be sure. Now, what encouraged me, I went quickly to my email. My ARCP panel chairman had written me, "Congratulations on your SCA success." So I was like, wow, so you people also follow this up. So when I saw that, and I was alone because I was so tense that I couldn't stay where people were. I'm not sure how I will feel with the result. So I just stayed in a closed room. And when I saw the result, this is pass, pass, pass. And I started screaming suddenly. So I told my family, they've been affected a lot with my challenges. They're so happy. I don't know, probably when I get a salaried GP job, I will call a few friends to celebrate with me.
Thank you very much for sharing.
For the good work. The
Mm,
coaching is the best part of that. If you see, I couldn't even get time to attend the
class.
workshop, and I didn't get, but the coaching was just it for me. It
Okay.
was just it. I attended just one workshop, and it was in between work and
Okay.
yeah.
Right. So thank you very much for sharing your story, Dr. Chisom. And I'm pleased to see that now you're happy and you can have your life back.
I am. I am. And I wish everybody passing through this same path I passed through will also smile someday.
Thank you so much. I mean, if you found this inspiring story help you today, then let us know down in the comment. Write down in the comment what was your main takeaway. If you found this video useful, you might want to watch the next video here. Click here and I'll see you on the other side.